Hello viewers, welcome and assalamu alaikum wa rahmatullah. Today I'm by name Ibrahim Abubakar Gandhi, medical laboratory scientist by profession. Today we are going to talk about diabetes mellitus. So in this our video, it is having 4 parts: the introductory part, the pathophysiology / cause or etiology, the lab findings, and finally treatment. So you can follow us and see how it will be. First of all, the introduction. So in the introduction, first of all, we are having the definition of the diabetes. When we say diabetes mellitus, what comes into your mind? So diabetes mellitus is something or is a condition in which the blood glucose will go high and then the cells cannot take the advantage of it. But first of all, before we go to the definition, there are some keywords that we need to know. Something like hyperglycemia, and hypoglycemic hormones and hyperglycemic hormone. So when we say the word hyper means high. When something increases, it is what we refer to as high, while when something increases down, it is what we refer to as hypo. So in this hyperglycemia is a condition in which the blood glucose will go high, and then the hypoglycemia is a condition in which the blood glucose will go low. So there are hormones and then also mechanical activities that controls the metabolic activities that make person be healthier. So first of all, the definition of the diabetes. Diabetes is condition in which the blood glucose level will go high, where the cells or body cells cannot take the advantage of it. So according to this definition, we can see that it is condition in which the blood glucose level will go high, where the body cells cannot take the advantage of it. What does it mean? In our normal physiology, when we take food, it goes to our mouth, it is being digested with the help of saliva, the tongue, and the teeth. It goes to our esophagus, we swallow it, then it goes into our stomach, where with the help of some gastric secretion and other action of enzymes and other pancreatic secretion, then digestion will occur. When the digestion occurs, in food we are having different diets. We are having carbohydrate, protein, lipid, and so on and so forth. So when it is carbohydrate, then it is now break down into the building block which we call glucose. We know that glucose is the building block of carbohydrate. It will now be absorbed into the body, where it will be transported through the bloodstream. When it goes to bloodstream, then there will be stimulation of pancreas. Pancreas is an organ of the body which takes part in two functions, and as exocrine part and also endocrine part. The endocrine part it is having 3 specialized cells, which are alpha, beta, and delta. The alpha cells are producing the hormones that we call glucagon, and the beta cells will produce the hormone that we call insulin, and the delta cells will produce the hormone that we call somatostatin. So this glucagon is among the hyperglycemic hormone. When we say hyperglycemic hormone, is a hormone that is responsible for making more glucose in the blood. That it just always want to see glucose in the bloodstream. So therefore, it increases the level of the blood glucose. When we say insulin, then it is hypoglycemic hormone. Hypoglycemic hormone, which It is hormones that is decreasing the level of the glucose in the blood. All it target is always to increase the level of the blood glucose. How is this possible? When beta cells, they are all situated in the tail of pancreas. Tail of pancreas. When the pancreas produce this hormone that we call insulin, which is hypoglycemic hormone, into the bloodstream, then it will go and bind to the cell receptors. When it binds to cell receptors, the glucose will just serve as a key that will allow or enables the cell to open. When it opens, then the glucose intake will occur. It will take place. When it takes place, then the body cells will utilize the glucose and take advantage of it in order to produce energy in form of ATP. So in this case, this is healthy person. But when there is case of this diabetes mellitus, person will eat, the glucose will be absorbed through the bloodstream. When it is absorbed through the bloodstream, then the blood glucose will go high, which is what we refer to as hyperglycemia. Hyperglycemia is nothing but condition in which the blood glucose is in high amounts. So on the diabetes mellitus, the insulin maybe will be produced or will not be produced, so the blood glucose will be circulating into blood, that is the glucose intake will continue to be as hyperglycemia, where the glucose cannot take to the cell, maybe due to any deficiency or any hormonal disorder, which is insulin, because insulin is responsible for the reduction of the blood glucose level. So in this case, as we're having different types of diabetes, it is depending on the type of diabetes we have. We might know whether it is the problem of the insulin that maybe it is not produced at all, or maybe there is resistance of it. What we call resistance is nothing but there will be much amount of insulin, but it cannot be able to bind to the cells, maybe due to any factor or any problem for this. So in brief, this is about the introduction of the diabetes mellitus. But first of all, it is condition in which blood glucose level will be high where the cells of the body cannot take the advantage of it. There will be much of blood glucose, that is, there will be much sugar in the blood, but the cells cannot be utilized by that sugar. So this is it. And then now we are going to pathophysiology. As I already explained, this is our first part. Our second part, which is pathophysiology or etiology. When we say pathophysiology, it's nothing but how the occurrence of this diabetes mellitus happens in the body. So listen up, in this case, it is very important for you to understand how the issue is. Now, when the blood glucose, it is into circulation, blood glucose, that it is being absorbed from the small intestine, maybe from the microvilli of the small intestine, then it will be going through the bloodstream circulation, which, as I mentioned or I have already earlier, it is what we call hyperglycemia, which is the condition in which the blood glucose will be high. Now, the glucose will be roaming freely in the bloodstream, where it will go to pancreas. Pancreas, it is the organ that is producing the hormone which is responsible for the decreasing down of the hyperglycemia into hypoglycemia. When it goes to pancreas, it will stimulate it in order to produce what we call insulin. Insulin is nothing but hormone, which is chemical secretion, that is releasing through the bloodstream in order to maybe to take to any specific cell that it's going to work on. So when the insulin is produced, then it will continue to go to other to go to around the body through the bloodstream. It will go and bind to the cell receptors. When this process happens, then the blood glucose intake will occur or will happen in the body. So now maybe when we're having problem of this insulin, that it cannot be able to be maybe it cannot be able to be produced or cannot be able to be secreted, then it is the condition that will lead to there will be blood glucose, that is blood glucose in the blood, it will be high. While this cannot be able to be produced, then it will be roaming freely in the bloodstream, where when this happens, then the blood circulation will go to kidney, and we know that kidney is the organ that filters the blood. So whatever the kidney is, maybe it is electrolyte or it is sugar or anything that is unusual or water, then it will secrete it, it will just filter the blood and remove it from there. So, and then our cells of the body need this glucose because it is going to convert it into pyruvate in order to produce energy in form of ATP. So now, what do you think when our body cells cannot get this ATP? Because it is the what? It is the energy that enables them to perform or to carry out their well function. So when there is absence of this ATP, then the cells are not taking the advantage of this blood glucose. It will just come into our blood. When it comes, then it will go to the kidney. When it goes to the kidney, then it is going to be excreted and then urinate through the urine. So for this, in brief, this is a pathophysiology or the etiology. But when we say maybe the etiology, this time etiology, it is just like cause. What cause the diabetes mellitus? So causes of diabetes mellitus, it is dependent on maybe what happened. Because, you know, as we're having different types of diabetes, we're having type 1 diabetes, we're having type 2, we're having also gestational diabetes, but that gestational diabetes is not that considerable. Maybe it is considerable to some cases or to some extent. And this type 1, it is what we call insulin independent. Insulin dependent diabetes. While this second one, it is what we call insulin resistance. This, in brief, means that in this type 1, which is the insulin dependent diabetes, it is the case in which the beta cells cannot be able to produce it cannot be able to produce any amount of insulin, or it can be able to produce very minute or very less insulin. So in this case, the blood glucose will be roaming freely. It cannot be able to be taken by their cells because it is only when there is insulin, when it is bound to the cell receptors, then it can be able to make the cells open in order for the glucose to be taken in order to make metabolism or anything to produce energy. So when there is total, that is no production of insulin, or maybe minute amount, which is very less, minute amount will be produced. So this is what we call type 1 diabetes, which is insulin dependent. While in this insulin resistant diabetes, which is type 2, there is production of insulin, but maybe it fails to do its works. How? When maybe there is any problem, maybe related to the insulin, maybe PEC insulin is produced, or any other problem. So sometimes, as it is not clear what exactly caused that, but sometimes it is due to the taking of maybe very much higher of glucose that your body need to maybe compensate in order to make metabolism to go well. So by trying that, the beta cells of the pancreas will be more stimulated in order to produce much higher amounts of insulin in order for the metabolism to carry it out. So in that case, the beta cells will try to produce as much as glucose it can provide. So maybe it's due to that production of much amount of glucose, then it will produce even the fake one. Because it's something like maybe when you are asked maybe to do something that it is beyond your ability, you know that maybe you can do it something, you can add something that is not maybe part of it, or you can do even rubbish. So something like that. When the beta cells of the pancreas are asked to produce much amounts of glucose, insulin, then it will produce much, where it will produce maybe even the fake one. So it is a problem that causes this type 2 diabetes. So sometimes, or in many cases, this type 1 diabetes is common in children, while this is common in adults. So, and babe, this is about the pathophysiology, or I should say the etiology. That is the cause of the diabetes mellitus, and then also how it works. How it works is maybe when there is no production of insulin, or there will be production of insulin, but due to some problems, it cannot be able to bind to the cell receptors. When it binds to the cell receptors, and to open the cells in order for the glucose to be intact, in order to make metabolism where ATP will be produced, energy in form of ATP for the cells to utilize it. So the blood glucose will be high. So now we are going to define our part 3, which is lab findings. So when we say lab findings, we are referring to laboratory diagnosis. We are referring to laboratory diagnosis. How do we diagnose this diabetes mellitus? So, as it is maybe many categories, many things we are using to diagnose this diabetes mellitus. First of all, is we can detect glucose in the urine, which we call glycosuria. This glycosuria is nothing but the presence of glucose in urine, and which is happening maybe when the kidney filter all unwanted glucose, and unwanted electrolytes, and unwanted water to produce urine. So when the urine is passed out, then you might find out that there is presence of glucose, which it is the first thing that indicates there is diabetes mellitus. But there are major lab findings or laboratory findings that we do in this diabetes mellitus. First of all, we are having oral glucose tolerance test. Oral glucose tolerance test. And this oral glucose tolerance test, we are giving some amount of glucose to patient that he will take, and we'll see how his body can tolerate the glucose that is taken to him, which may help to indicate maybe if he is diabetic, pre-diabetic, or non-diabetic. This is it. And the second, we are having A1C. A1C is also a test that we carried out in the laboratory that will help us to see how much the amount of maybe the binding of the glucose in the body. This is something that we use to identify or to diagnose maybe when there is presence of diabetes mellitus on us. Number 3, we are having fasting glucose. Fasting glucose. We also run this test in the laboratory that will help us that will enable us to see if a patient maybe is having diabetes or not. So apart from this, there are other many tests that we can be able to carry out in order to access or to know the diabetes mellitus. And then there is normal range when maybe it is 140 mg per dl. When the range of the diabetes find in the laboratory diagnosis is above this 140, as maybe it is ranged from 190 to 200. When it is something like this, it is diabetes. And there is also pre-diabetic, which the pre-diabetic stage is nothing but the stage in which person is neither diabetic and also non-healthy person. That is maybe he is going to diabetes, which is maybe when the range is above 140, but it does not reach to 200 or some parameters like this. That is what we refer to as pre-diabetic. So also there are many lab findings or lab diagnoses that we can be able to access in order to know whether the patient is diabetic or non-diabetic. Then now we are going to our last and the final part, which is treatment. In this part, we are going to know how to treat diabetes. So even though diabetes, it is ranging, or it is maybe categorized into many categories. As I said, we have type 1, type 2, we have gestational diabetes, but gestational diabetes is not sometimes that considerable. But the type 1 and type 2, as we know that type 1 is insulin dependent diabetes. Type 1 is insulin dependent diabetes, while type 2 is insulin resistance diabetes. In this, we are directly given insulin injection. In this, we are directly, sometimes we use some oral tablets that we can use to cure this one. And then apart from this, sometimes physical activities help. Physical activities help because when you are engaging yourself with physical activities, it helps to boost your cell receptors, it burns some calories, and then it helps also to make your immune system to be strong, and so on and so forth. So physical activities sometimes can help. And then also controlling your diets. Controlling of your diet. Also diets, when you control your diet, you know what to eat, maybe something that will make you healthier and make you healthy, then that one also help. And then there is many things that we can use in order to assess this. When one person is having diabetes mellitus, we can use maybe Dixon in order to cure it, or in order to reduce the risk factors. And then also there are risk factors that maybe includes one person is obese, or when he is not engaging himself in physical activities or something like that, then he may be able to be diabetic or pre-diabetic patient. So this is it in all. This is a brief about diabetes mellitus. I would just like to have a recall on what I have all done. In summary, we're having 4 parts. We are having introduction, pathophysiology, lab findings, treatment. In the introduction, we define diabetes as condition in which the blood glucose level will be high, while the body cells cannot take the advantage of the blood glucose. And then it is the specialized cells, 3 specialized cells, which are situated in the tail of pancreas. In the tail of pancreas, it is what produces the insulin. Insulin, it is what hypoglycemic hormone, which helps to decrease down the body, the level of the blood sugar in the body. And then when the blood glucose is taken to the cells, it is used to produce ATP. But when it fails to do that, then that shows that the body is having maybe problem with insulin production, which lead to diabetes. So in brief, our pathophysiology is glucose goes to the bloodstream. When it is absorbed, then the pancreas will produce insulin, then it binds to the cell receptor, then it enables the glucose to be injected into the body cells. So when this process fails to happen, that is when there will not be production of insulin, or there will be a problem with insulin, then the whole process cannot be able to be carried out. So in that case, where the blood glucose will be high, then it is what we refer to as diabetes mellitus. And then apart from this etiology, then we are having lab findings. In our lab findings, we are doing oral glucotones, A1C, glucose percent, and other things. The range is 140 mg per dl. When it is above that, that is the range between 190 and 200 is to indicate diabetes. And then the treatment, we are given insulin in type 1 diabetes. We are given oral tab in type 2 diabetes. And then physical activities also help. And then controlling of your diet help. And other something that you may use in order to make you be healthier. So this is the end of our video. Please, if it is your first time, subscribe, like and share, and then join us to the next video in order to see other beneficial lectures. Thank you.